I think I'm live. Hi, it's Rita at Travel Nurse Channel, and I'm so glad you found me. I'm coming in closer, moving in. Okay, so yeah, you found me. Travel Nurse Channel. Okay, Facebook and YouTube, and I'll be here every, today's Tuesday, the 4th of August, and I'll be back here on Friday and every Tuesday and Friday. Okay, I'm a little twitchy. Get comfortable. And August 4th. August 5th is my niece's birthday, so I'll shout out, happy birthday, Kayla. It's Aunt Rita, if you find me. And have a wonderful birthday in Boston. I'm not sure how locked down you guys are, but have some fun. I know you know how to do that. All right. Let's try to get rid of the glare. Never can quite do it. So, so all the wonderful nurses out there, all the wonderful techs and therapists and allied and doctors and employers and recruiters, welcome, welcome, welcome to the Travel Nurse Channel. I hope you're finding us. I hope you decide to advertise with us, and I'd love to hear from you. When I'm live on Tuesdays and Fridays, 12:30, I am sorry, I am not catching the clock on time. I'm a few minutes late today, but usually between 12:30 and 1:30, I am here chatting with you, either just myself or from time to time I have guests. I've had some wonderful guests, nurses and therapists, and I'm going to keep going with that because their stories are something we all can learn from and enjoy. And it's not always a good story, but we can learn from it. So, so please tune in. And anybody that is seeking a nurse or a allied or a therapist or a tech, etc., you can advertise here at this site, the Travel Nurse Channel on Facebook, for a very nominal fee. So please give us a holler, check us out, or contact me, and I can respond right away if I have an answer or get back to you. And you can also email me, rita@travelnursechannel.com. Okay, so all that's out of the way. We've been talking a lot about travel and travel assignments and how good they are, and you know, what are some cons if you're thinking about traveling for the first time or getting back to traveling. And what's a good idea? Should you travel with more than one company? You know, what are the perks? What are, you know, can it enhance your career? There's just an awful lot to it, and we've talked about it probably the last 3 or 4 times that I've been videoing. So I thought, let's talk about this 6-letter word that some people talk about it a lot, and some people do not talk about it. And is it normal and is it not normal? So the 6-letter word is stress, S-T-R-E-S-S. It's a 6-letter word. It's not a bad word. It's kind of something that occurs. It's a normal occurrence to have some stress. Can it be, if you have too much, can it be a problem? Yes, it can affect you physically, emotionally, and psychologically and mentally. So, so there you go. So stress is normal. It's normal to have a little stress. For example, if you sleep through your alarm, you're a little stressed that you might not make it to work on time. So that's normal. It makes you move faster and take a quicker shower, etc. But there are some signs that we should all recognize when it gets to be too much. And it's possible, yes, it's probable, that I decided to speak on this topic because the past few weeks, and most particularly the last day, has been stressful for me. And then I thought, you know, I got to get it together. I'm tired of feeling like this, and, you know, started to deal with it. And in my case, it is somewhat caregiving, but a caregiving issue. And I've experienced that before when my mom first had a stroke about 9 years ago. I don't know if it's going on 10 or going on 9. It happened in November. And the first 2 years were really difficult, and I became my mother's caregiver. And you don't always plan on being a caregiver, right? Like if you have a baby, you plan on taking care of your baby and you plan for it. Excuse me. I'm drinking green juice, I want you to know. 100% green juice. And it's not bad. They put some lemon or lime in it. It really helps. But that's one thing, is take care of your, what you're eating healthy and so forth. Let's see, travel somebody, anonymous. Stress is taking its toll. Yes, it takes its toll. Right. So you have to recognize what's normal stress and what's too much stress, and recognize when it gets a little out of control. So in the case of my mom, I did have some help. I had my husband and my daughter helping with some of the things that were going on, but I was working, I was running to the hospital, I was going back at night, and then when she got home, I was doing the same kind of routine, and it was too much, and she was in a state of shock, and then she became very, very demanding, and as she got safer at taking care of herself, I had to set some goals, and I said, if you keep yelling at me, I will leave. And then she kept yelling at me, and twice during that period I left. I knew she was safe enough, and I left. So I had to take care of myself, and I had to, go to my brothers and sister at the time and my husband and say, this is what I can do and this is what I can't do, So it was just too much. And doing her bills and having her get all excited about how the bills were doing, I just said, somebody please take over. And it took a while to get through it and get organized and get the help I needed and the help she needed and so forth. So I recognized that. And so a little something like that crept up in our household, where there's caregiving for my family and the baby and my husband and the household and so forth. And so that inspired me to talk about this stress and how it takes its toll. And the same thing is probably happening. I see it happening with my friends that are still in the clinical settings and the COVID, they call it the COVID time. It's quite stressful. So I have friends and I have acquaintances and I talk to them often, and they express how it goes for them and some of the things that help. Okay, so what can you recognize? I have a whole list of things, but I'm going to break it down to, I think I'll break it down to 5 and then see, I'll expound on it. How's that? Okay, so one of the signs could be low energy, like a constant low energy. I mean, everybody doesn't always sleep perfectly every night, but if you're constantly having low energy in the morning, in the middle of the day, at the end of the day, you're dragging yourself around, that could be a sign of too much stress. Whoops, another comment. Let's see. Travel Nurse Channel, can you get recommendations based on your specialty? Ed, my specialty, this week's new assignments are up. Over $5,000 a week for some specialty nurses. Click on the job to start chatting with a recruiter. This is like an ad. $5,389 a week for RN ICU in Texas, for RN ICU in Mission Hills, California. The same amount, $5,389. Fort Worth, Texas, Mission Hills, California. The Mission Hills, California has 377 beds. The Fort Worth, Texas has 535 beds. So day shift, 4 12 hours they want, 4 12 hours. It's a 7-week assignment. It starts August 10th. Yeah, Fort Worth, Texas is really heavily recruiting ICU, so it's 4 12 hours a week. So if you feel up to it, if you're not feeling too stressed, come on to the Travel Nurse channel and look at some of these ads that are coming in. Okay, so where was I? Oh yeah, let me give you 5. Well, wait a minute. I have to show you my I have to show you my little card, because I made up a card to say we're going to discuss a 6-letter word. Yeah, stress. So that's the topic for today, stress. And is it normal? Yes, some stress is normal. But as that anonymous person said, stress can take its toll. Yes, it can. And when it's taken its toll and you're getting kind of out of that normal range of what is a normal amount of stress, you know, a little irritability, a little one bad night's sleep, or something like that, or you're tired or something. That's normal. Those are normal reactions to stress, right? Fight or flight. So I'm just get the heck out of here because I'm so stressed out, or I'm going to have, you know, I'm going to have to fight with somebody because I am so aggravated. I mean, a little bit of that is normal, and don't hit anybody. Okay, but too much, you're getting into that not normal, and that's when you want to start recognizing things and doing something about it. And there's lots of things we can do about it. But low energy, headaches, actually upset tummy, you know, abdominal disturbances, whether it's diarrhea or nausea or constipation, all of these things, you're getting out of the normal range. And if you're experiencing a lot of that, then take another look at everything that's going on in your work life and in your personal life. Chest pain, rapid heartbeat, that is definitely getting to be too much. If you're sick a lot, if you're catching every cold that comes by and infections, and you know you got something going on with your nose or something going on with your skin, again, that's a bit too much. And then I can say it, I'm a nurse, but if you have a poor sex drive and maybe sexual ability has been affected, that is another sign. There are many other signs. There's a lot of body aches that can occur, you know, physical maladies as well as the headache. Headache is pretty typical. I said not getting enough sleep, but too much sleep. If you're tired all that time, if you have that low energy and you're not at work and all you do is sleep, you know, if you're working 2 or 3 or 4 12-hour shifts broken up throughout the week and all you do on the other days is sleep, 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 something may be going on. I mean, you do need to recoup. You need to rest and you need to sleep. So 7 or 8 hours is pretty typical for an adult, and that's what you really need to get. But you could be sleeping too much. So you could be sleeping 10 and 12 hours and 13 hours and most of the day and night. That's probably a sign. Here's another one that if it goes on for any length of time, it's something to think about. I feel like I normally am a little bit closer, maybe? Okay. I'm not sure. I hope you can see me and hear me well. But what was I going to say? Oh, yeah. If you start to lose interest in things that you normally enjoyed, you know? So if you normally like to do the New York Times crossword puzzle, and suddenly, like, you don't want to look at the paper, you don't want to do it. If you used to enjoy, I'm trying to think of some things we do when we're not, you know, while we're not being as social as we used to be, for obvious reasons. So if you always enjoyed jogging, and you're just like, kick those shoes under the bed, I am done, I'm not jogging anymore. So things, if you just start to, you know, lack of interest in sex and so forth. So lack of interest, and these are things that I'm talking about, that not an occasional thing, but things that are really occurring a lot that you really need to take a look at. And then what was another thing? Just feeling sad. I mean, obviously, we do get sad, and I think we are prepared for that early in life. What is something, well, they used to slap the baby. What was I was reading something and it was so familiar. Oh, when I was a kid, on your birthday, you used to get a spank, a slap, could just be a little tap or a little boot, smack on the boot. But we did it in my family because I had 3 siblings, and I think our parents did it too, or grandparents. I'm not sure. So if you were 3 years old, come here. You got 1, 2, 3, and then 1 for good luck, 1 to grow on. And I'm not sure what that's all about. Is that because it's preparing you at 3 years old or 7 years old, or my memory doesn't go back to 3, but I certainly remember being young, let's say 7. And then, yeah, in school and my siblings, they used to like, oh, it's your birthday, how old are you? And start smacking you 10 or 12 times, oh, 1 for good luck, That was a crazy thing, but I think some of those things, those little mini hardships, is a reality check, because life is not a bowl of cherries and rainbows and unicorns, but it's all we got. This is it, right? What's the alternative? Life can be wonderful. I mean, when I look at that baby every day and she smiles at me and I see her feeling good after her baba or her poo-poo, life can be very good, right? Rainbows are good, stars are good, all that stuff. But if you start to feel sad, morosely sad all the time, that's probably too much stress. Okay, so I think, oh, I know it. Talked about sex. I may as well talk about drug abuse. So if you start to abuse, if you like wine with your meals or a nice ice cold beer on a hot day, that's fantastic, And if you use marijuana for whatever, backaches or whatever, that's okay too. But it's the abuse of not just street drugs or over-the-counter drugs, but prescription drugs. If you start to abuse alcohol or drugs or medications, please recognize that is not okay. If you start taking pain pills round the clock, you're just camouflaging stressors that need to be recognized and managed, right? Okay, so here we are. We're a bunch of caregivers. We love our job as a rule, but we've gotten into some kind of situation. And oh, here's another anonymous. What kind of nursing have I done? It's totally off topic. I've talked about my career. I've had a wonderful career, and I've done many, many things. Most recently, my clinical work was a few years back in interventional radiology and cardiac cath in the pre and post-op areas. I assisted with a lot of procedures. I did a lot of conscious sedation, and I loved it. Okay. It's wonderful. Those cases, a lot of them were outpatient, a lot of them were inpatient, some of them were critical, but there were beginnings and ends to most of the cases, and a lot of follow through, and I really, really loved it. So that was my most recent job. My earlier career, I started in dialysis, and then I started having my babies, and I do not know why I can't stay centered, folks. I think my camera's wobbly. There we go. Okay, now part of my head's cut off, but that's okay. Okay, I can back up, I suppose. All right, so finally, and I don't know. Ay. Take the pillow out. Finally. Okay, yeah, I did ICU. I did my share of med surg. I did a little teeny bit of psych, a little teeny bit of pediatric, did a little teeny bit of hospice, and I did some clinic work. I did do some research studies with a customer that was involved in that, And yeah, I picked up on that when I didn't have other nurses to fill that. I was a manager for a long time of All-Star Staffing, a per diem and travel staffing company. And let's see, med-surg, tele, psych. Oh, yeah, now it's a little too. Oh, yeah. Okay, you can obviously, I'm no production artist, right? I'm either too low or too high. All right, try the pillow again. All right, let's just leave it at that, folks. I'm sorry I'm yellow, and I'm sorry, I'm sorry I'm not centered, but I'm happy to talk to you. So thank you for your questions. I've done a lot of nursing. I've done some long-term. I pinch hit for my agency when I worked for an agency in long-term facilities, and that was great too. Back in the day when I did that, there would be an RN supervising in a skilled nursing and rehab, and primarily the RNs were doing much of the medications. The aides, the nurse aides, did a lot of the daily living work, and then the RN was in charge of reviewing, evaluating some wound care, if there were injectable meds and so forth. So that was interesting. Made for some long nights for me, particularly if I was coming in as a relief person and didn't know the staff. That's kind of interesting, and you have to get to know the staff and let them know that it's a serious job, and you don't tolerate shutting one eye, which a lot of that can go on night shifts. Anyway, so yeah, I've had a really terrific career. I'm trying to think of some of the highlights. I really did love interventional. I did ICU after doing swing shifts. No, before that, I did. Dialysis was one of my first jobs. And then before I had my first child, I switched to the hospital, and I did, went to a hospital. Anyway, somewhere in my early years of my career, I had quite a bit of ICU, and that was all back in New York. And then when I moved to California, I had my second child, I wound up in an ICU again because I was still doing 8-hour shifts, and it was the best shift when I had 2 little kids at home. I could do 3 to 11 or 4 to midnight and be with the kids all day. So that was great. And see, being too tired when you're working really hard is normal. When you're reaching that that line of not normal is when there's no explanation for constantly being tired. So yeah, if you get up early and work all day and then work again till midnight at your job, and then you come home, you know, and have a snack and then sleep for 6 hours and start taking care of babies again, you're expected to be tired because you've actually used your mind and body, you've overused it. And so you play catch up a lot. Sometimes when the kids nap and you have a day off, you should nap or at least rest. All right, so back to the topic at hand is recognizing stress. So we talked about headaches and low energy and poor sleep or too much sleep, upset tummies and chest pain. Hard to ignore that one. Oh, you know, and I said feeling sad, but just feeling overwhelmed, feeling like you can't catch your breath, you know, with every little task you're doing. That's too much. That's too much stress, folks. And so I want you to please, please, please take care of yourself, okay? And one of the ways you can take care of yourself is taking a break. So if it's happening and you're in the middle of a shift, you're already committed, good idea then to talk to your supervisor and just say, I'm so overwhelmed. I passed my meds, but my diabetic patient is not responding to the insulin. The doctor's not answering a call, whatever. And you get to this point where you're so overwhelmed, go to your supervisor and say, do you mind if I just take 20 or 30 minutes? I'll get some fresh air and a cup of tea, whatever. And hopefully your supervisor recognizes that this is not an occurrence that they see very often. And even if you're a traveler, it can happen. You can you sometimes just don't see it coming. You know, you feel tired or you have the couple of headaches and you just go, oh, well, you know, but all of a sudden it catches up with you. So seek some help. Please seek some help. talk to your supervisor, take your break, and see if you don't improve a little bit. And if you don't, then maybe you can't finish that shift, okay? Maybe the break has to be a couple of days. And so caring for yourself is very, very important. You care for others, and you consider all that is needed to take care of them. Well, do it for yourself, okay? Because the time, it comes sometimes, you know, and that's what you do. So you have to sometimes just remove yourself from whatever it is that's overwhelming you. Another thing is that you may need to discuss it with your doctor. Actually, in my clinic, oh, I forgot about being a clinical supervisor and running my agency and all of that. So I will tell you that when I was a clinical manager, had nurses working all over the place, and we took turns in this rotation of clinical managers and would do call. Okay, we would do 2 weeks of call. So that means after our, 50, usually easily a 50-hour work week at our desks and at our meetings and with our, compadres, that we would take the call. So we would go home, roll the phones to ourselves, and take call from whatever it was, Sunday to Sunday for 2 weeks. And, we had many people in the clinical area throughout the country working that might need, it might just be a question about their assignment or something that the recruiter didn't get back to them or something. But it could also be something, something like this, a stressful situation that they weren't able to cope with and manage. And I had a situation like that, and I wanted to do the best I could with it. So one thing I learned is keep the person on the phone. And so I had someone that was on assignment that found the assignment very stressful, that admitted that she did take some antidepressants, some kind of mental health medication, and that she didn't get enough and she was concerned about it, or maybe had run out and was out of state, and they thought that they would fill it, or something had happened with her medication. And this young nurse, or this nurse, was very, very overwhelmed, very depressed, and just overwhelmed is what I heard, and had worked a night shift and didn't know that she could manage, didn't know what to do that day. And so I told her, had she eaten, had she drank, and I kind of gave her something to do and so forth. It's a little bit off track. But then I said to her, just give me a moment, will you? Don't hang up. I'll be right back. My other phone is ringing. That wasn't true. I called a compadre of mine, and I said, I have somebody in very bad shape, out of state, on a travel assignment, and what can we do? So I got some advice from that person, who was somebody I could call. Could we arrange to get her safely back to her home state, back to the doctor, back to what she needed, and so forth. And over a series of a couple of hours, things were resolved pretty well, and no harm came to that nurse or her patients. Fortunately, she called after she got off duty. So it's very, very, very important to care for yourself. You're a healthcare worker. You know a lot of signs and symptoms. If you're a nurse, you know a lot about medicine. If you're a tech, you know a little bit about medicine. But just be aware of those stressful signs. Too many headaches, too many body aches, tummy aches, catching a lot of colds and infections, feeling extremely sad, feeling exceedingly disinterested in everything. Care for yourself. Call your doctor. Yeah. And then if you don't have multiple symptoms, or you feel like you're managing, but it's getting a little bit more than you can stand, maybe just call a friend. Yeah. Use social support. Something I do And it's very, very helpful. Sometimes you don't want advice or anything. You just want to vent. You know, I am tired of the dog pooping on the rug. I am tired of everybody calling me when I'm tired, you know, whatever it is. So, so definitely you have to discuss it. You have to recognize it. You probably should check in with an MD and find out what it is that you're doing, what is overwhelming you. You know, I talked to my friend the other day, and she said, everything is annoying. Everybody is annoying me. And I, you know, she's a post-COVID, you know, she's a couple of months post having the COVID, and some of the symptoms were still around, like she wasn't tasting and smelling as well, but the irritability was kind of new. And I said that to her. I said, maybe something's going on. Maybe you're sick. Maybe it's COVID. Maybe it's not. And it turns out she had a urinary tract infection. There you go. All right. So talk to a doctor. How about you've lost interest in everything, and so you're not doing your jogging or your walking or your whatever it is. I mean, many of us can't go to the gym. In California, we can't go to the gyms because they closed them down. I miss my Pilates studio. But set some realistic goals. Just when you can. I know you're working 12-hour shifts, but you can find some time in your days off. Or you can park further from the hospital and walk to your car for 5 or 10 minutes. So set some realistic goals. Like just say, you know what, last night, the last 3 nights, I've only slept 5 hours. The TV's been on. I just, you know, you're out of your environment if you're traveling. So it's not your bed. It's not your house. It's, you know, maybe a noisier, maybe you're in a big city. Maybe there's traffic noise. So do some things to help you sleep, right? You can spray some lavender, put a lavender sachet in the bed with you. Take a warm bath before you go to sleep. Hydrate. Make sure you're hydrated. Eating healthy, all of these things. Set some realistic goals. Just say, okay, this week, backing off the sweets. Okay, I'm going to buy some fresh grapes and cut up a pineapple, whatever. I'm just going to cut back and take care of myself. And if you just can get a little bit more sleep and feel a little healthier, it makes a world of difference. But I do think checking in with some, you know, getting some social support from a friend, another nurse maybe, or another tech. Maybe you're actually on travel assignment with someone from your hometown, or maybe you just need to hear that familiar voice from your hometown. So those are things you can do. Set some realistic goals for yourself. Get the help that you need. And before you know it, your self-esteem is improving and your sense of autonomy is improving. Maybe medication. If medication is a requirement, you're going to have to practice patience with that, because my understanding is a lot of the antidepressants and the anti-anxieties, more so the antidepressants, do take some time to start doing what they do. So just, you know, the little things, the hydrating, a little bit of exercise, maybe trying to do some of the things that you used to enjoy. Maybe you did enjoy knitting, or I'm not sure, you know, or social capacity, you know, to go and dine with friends and maybe play cards and things like that, go to concerts. A lot of those things are curtailed. Why can't I say that word? Curtailed right now during this pandemic, but there is light at the end of the tunnel. I mean, there are things you can do. You can wear masks. I loved a movie. I love movies, and we had a movie club with 5 couples. We had a couple of years of lots of fun with our movie club, either going out to a movie together or watching the movie, then getting together for a dinner and a potluck, discussing the movie. Our one friends, I missed it this summer because they usually do sometime during the summer. They would show a movie outside their home. They had a big wall and a big patio. We'd be out there with blankets and socks and comfortable chairs, and watch a movie and have a great meal, and just that camaraderie is so wonderful. I just texted all those, no, I emailed everybody about a week ago about how much I miss them and all the things I've been watching on Netflix and Amazon, and got some good recommendations about what they were watching and so forth. So, yeah, I think something too to mention, how's the time going? Yeah, we're okay. We've got some time. Is routines are very helpful when you feel sort of out of whack and overwhelmed. If you're managing and so forth, and you can recognize some of the triggers. So let's just say a travel nurse is managing. You know, she's managed to get her stress level from up here down to, you know, more normal range, but recognize what the triggers are and when too much is too much, and have that discussion with your supervisor, and just say, you remember, so say you're on a 13-week assignment, and in your second or third week, you were rolling along, you got your orientation, you're comfortable with your workload and so forth, but little by little, more things were being added on, you know. Oh, we don't have any CNAs today. Everybody's going to have to do bedside care. Now, you know, if you're working in a busy tele unit and so forth, that's a lot to work in, depending on your patient quotas. Or we're short-staffed, we won't have a charge today. Oh, you be in charge. And so now you've got your full patient load, which may be 5 patients, all on tele, all with serious acute issues. And now they're asking you to be the charge nurse, and you've only been there 2.5, 3 weeks. So you might have to go to the supervisor and say, I really am feeling overwhelmed, and can I share this position? Can we do something that I'm feeling overwhelmed, you know? So it could be you're a staff nurse, and they keep having you mentor all the travelers. And, you know, you just want to break. You just want to kind of go back to your normal routine. Have that conversation with your supervisor. Say, you know, I normally really enjoy this, but since we've been in this pandemic with this, you know, COVID and everything, I have like, oh my gosh, in the last 6 months, I've mentored like 4 travelers. And I just want to be able to do my work and connect with my patients and families, and not be teaching and answering questions all 12 hours. You know, can you work with me, supervisor? Can you give the next traveler to one of my cohorts? You know, so kind of recognize the triggers, and that point where you go from I'm managing, I'm fine, it's a good day, to ay, you know, everything is agitating me and aggravating me, and I might just, here, my poor little doll, I might have to beat the heck out of somebody. Oh no, she's a nice little doll. Gotta save that for my granddaughter. Anyway, these are just suggestions, folks. Been there, done that, and want everybody else to do well, to have the best experiences you can. So come to the Travel Nurse channel. Apparently, there's a bunch of ads there in Fort Worth. $5,389 a week for an ICU nurse in a big 535-bed hospital, but they want you there for 4 12-hour shifts a week. And if that's something that intrigues you, please come to the Travel Nurse channel. There are opportunities, another opportunity for the same big bucks, $5,389 a week, to start at, gosh, I might be mixing it up. It's start chatting with a recruiter. New assignments. Yeah, new assignments. Start chatting with a recruiter. Mission Hills Hospital in California, 377-bed hospital, 412s night shifts. They're looking, and that's a 13-week assignment. The Fort Worth, and that one starts August 17th, and the one in Fort Worth starts August 10th, pretty quick, but it's a 7-week assignment. So that's kind of cool. That's less than 2 months, and that's good money. And if you love ICU and you love to work 412s a week, go for it. Go for it. So it could be an exciting assignment. Vashti, if you're looking, that might be the thing for you. I know you prefer ER, but ICU is cool. All right. It's something I did. ER I didn't do. ICU I did quite a bit of. All right, folks. Thanks for anonymous people checking in during our chat. And don't worry about that 6-letter word. Don't worry, because you know what? Some stress is normal. It is, okay? And when it's not, there's many things you can do about it. Use your social network and get the social support you need. Call your doctor if you need to. Eat well, stay hydrated, sleep well, and please take care of yourself. Check back in with us on Friday. I'll have a new topic. Maybe I'll have a guest visitor to talk with us. And I thank you very much for tuning in. And I hope you'll check out some of the jobs that are happening on our site, on Facebook. We're also on YouTube, but Facebook is live Tuesdays and Fridays, okay? And happy birthday, Kayla. I love you, you beautiful child. Well, young woman. Bye.